Now, Sacramento, like many communities around this country, have what I would describe as a maldistribution of health.
One of the things that we did was a needs assessment to identify areas that had higher levels of chronic disease, and looking not just at death rates, but also looking at hospital admissions to hospitals and also other morbidity indicators. And what we found is that for each of the chronic diseases, there were 3 areas that always seemed to surface to the top. One in northern part of Sacramento, another one in downtown Sacramento, and another one in South Sacramento.
They need access to health insurance, for example. They need help in accessing those services, but they also need safe areas in which to do like physical exercise.
Our community needs to look at health beyond the walls of hospitals, clinics, and doctors' offices, and realize there are social needs as well that go together with health care to make a person healthy and have a good quality of life. And that is really, I think, what the Sacramento Healthy Coalition is trying to achieve.
Well, we have infrastructure, facilities, closed schools and things that are now offline in communities, and could become, in some situations, blight in communities. But that infrastructure also could be used to do some amazing things, like community gardens, or to reopen some of the open space, the playing fields of various sorts, baseball, soccer, other things, on that very same property. And that's just an example of what you can do through these joint use agreements. For us, we like to consider them to be best use agreements.
What you're looking at is 5.5 acres, 91 plots that have been jointly worked on by the school district, who owns the land and has allowed the neighborhood to utilize it. And this is the kind of thing that the coalition is working towards across Sacramento. You're talking joint use agreements that would bring about tremendous pride to the neighborhood, resources, economic value, social value. You can't beat that.
This project is critical and can play a pivotal role in bringing healthcare providers together with community partners. And the essence of that is the community health worker that can provide that linkage and can serve as a patient advocate and can connect a patient to community resources when they leave their doctor's office or the hospital to keep them healthy.
Shared interest equals shared success. So when we share in the interests of rebuilding our community, reshaping our community, making real transformative investments in our community, then we share in the success of what we create in our community.
Currently, we have representation of about 60 member organizations that are diverse in nature in terms of what we do and how we approach health and help to produce health. But we are certainly united in terms of our goal to eliminate the health disparities in our community.